one. We have one for Medicare, and if we do eligible for make a change out.
Jill, if you would like to go ahead and start, and then we'll begin with the content of the webinar. We'll remind everyone to put your phones on mute or star.
Well, we will actually put everybody on mute. So, Jill, if you'd like to start.
Thank you, Sharon. Welcome, everyone. As you know, I'm Jill Kagan with the Arch National Respite Network and Resource Center, and we are really pleased and excited today to be able to share with you a special demonstration from the Nebraska Respite Network on our eLifespan Respite System, which is an online information and referral service, as well as a secure online data and workspace system. I know that many of you who are Lifespan Respite grantees and your partnering organizations are working on your own or through partnerships you may have with your state respite coalition or your ADRCs to develop online respite registries and perhaps even a greater online capacity for streamlining your efforts to build the infrastructure for your coordinated lifespan respite system in your state. You should know that the Nebraska Respite Network was established in 1999 through state legislation, so they have been at this for a bit longer than most of the other lifespan respite grantees, and they have a lot of experience and insight that they're willing to share, so we're really grateful for that. I'm going to get right to it. We have with us today Sharon Johnson, who's with the Medicaid Long-Term Care Division in the Nebraska Department of Health and Human Services. She is the administrator of the Nebraska Respite Network and the Federal Lifespan Respite Grant. And she's joined today by her partner in this effort, Charlie Lewis, who is the project director for the Answers for Families project. And I'm going to just turn it right over to them and let them introduce themselves a little bit further and get on with the demonstration. So thank you very much again, Sharon and Charlie.
Thanks, Jill. Okay, so that for recording purposes, we have muted everyone, and then there will be opportunities, as indicated earlier, that you'll be able to ask questions, and we'll open up the phone lines. And in the meantime, we encourage you, as you're listening or hearing information, please use the chat box at the bottom of the right hand of your screen if you still have that open. Otherwise, it's full screen, but do use this as an interactive opportunity this afternoon as much as we can. In addition to Charlie, as Jill had mentioned, as the Answers for Families project director, I also want to acknowledge Jessica Cook, who has been instrumental in developing the eLifespan Respite services. Without the IT partners, we certainly wouldn't have gotten as far as we have with the evolving system. So thanks to both of these fine colleagues for the hard work that they do on a very regular basis. And with the overview, we felt that although many of you have known about Nebraska's respite network infrastructure or statewide respite infrastructure, we decided that an update and an overview might be helpful for some of you who are less familiar. One of the goals for this afternoon is more than sharing the insight about our own system and what it looks like based upon Nebraska needs, but we're hoping that it inspires you to some degree to be able to consider the possibilities for your own state respite requirements. There may be elements, or you may want to visit with the Answers for Families staff at some point to gather more detailed information. But with the overview, I'm going to highlight some of the key features of Nebraska's infrastructure. As you can imagine, for those of you who are familiar with your geography classes, like many of the states, large land mass, and again, as most know, and as your states also experience, considerable rural features to it. However, Nebraska is unique in that the furthest most eastern part of the state tends to be the urban areas. And so the need to improve access to respite resources and develop an improved consistency of reporting and sharing information, resources, mentoring one another, et cetera, taking advantage of current technology was an absolutely logical step for us. So that's part of the reason where the eLifespan evolved a number of months back. Again, just another highlight to visualize the state of Nebraska in comparison to some of the eastern states within our United States. The population of Nebraska is growing, and as many states experience the increase in various aging populations, as well as a multitude of refugee and ethnic populations, is expanding the opportunities for respite and what respite resources might need to look like. The Centers for Medicaid and Medicare and Medicaid Services, as well as the Administration on Aging, have invested considerable effort and finances in developing adequate supportive services to remain at home. And being able to accomplish that requires supporting our caregivers, and without spending much time on that whole philosophy, we understand the challenges with a diverse and widespread population can create for a system. So again, eLifespan is instrumental in being able to address some of those challenges. I want to visit briefly, and Jill opened her comments by indicating that Nebraska Respite Services itself have been in place in the state by statute since 1999, originally creating a statewide respite network as well as a respite coalition. And much of the coalition effort was surrounded around advocacy work that resulted in, among other things, in 2002, a statute being passed by our single house having established a Lifespan Respite Subsidy program. And so there is a difference, and as we talk this afternoon, I want you to understand the different facets of Nebraska's infrastructure, and I use the term infrastructure to mean a variety of resources related to respite, some of which directly impact the network or the coalition efforts, and others might be specific to the subsidy, and I'll make every effort to help you understand which one that I'm referring to. And in Nebraska, with the coalition, because I know some states, the coalition efforts is the predominant means by which respite services are carried out, and that's something unique in Nebraska because the coalition has a more of a supportive role, and it includes our respite network coordinators, but it does have some volunteers, and at the present time we are looking at the need for strategic planning, envisioning what our next direction needs to be, how we reach out and recruit additional partners, because once some of the early work was completed, it was understood by many of the volunteers that their work was done, and after a number of years we've come to realize no, there is in fact much more need for input, not only by family members, but certainly by volunteers and professionals in the health, in the human services arena, as well as caregivers who are using the services to make sure that we're meeting their needs. With the funding available to us, we are fortunate in that we have state funds allocated both for respite network activities, which is separate from, as I indicated earlier, the Lifespan Respite Subsidy program. So there are separate fundings And some of you may be using tobacco settlement funds in your states as well. And certainly in Nebraska, these tobacco settlement funds provide support to a significant number of programs. So we're fortunate that the need is present and we're able to communicate to the decision makers for the continuing funding. In addition, Nebraska clearly is a participant within the Administration on Aging grant. We are ending our current cycle in August of 2013, and a number of initiatives have been able to come to be as a result of this funding, notwithstanding the eLifespan Respite resource that we're focusing on this afternoon. But certainly crisis respite has had the opportunity to be tested, and as we'll continue to talk briefly, crisis respite is now, because of the success and the utilization, while there remains kinks to be worked out. Any new program and funding source doesn't just happen overnight. We all wish that it were that simple. It's not. But certainly the AOA grant has been an important part in allowing us to use these funds for that purpose. And then we also have an annual grant through the Department of Education, which utilizes the IDEA Part C funding, and with that focusing on services for children. And so there are some direct obligations that we have agreed to through the Department of Education, but all of the funding sources complement one another, and so we're able to meet many of our efforts through the variety of fundings that are available to us. And then I did not, of course, list a whole myriad of funds that any of the contracted organizations may also be accessing to support respite activities. Now, specific for federal funding streams for respite, we all probably are familiar with these, and I'm hoping that many of you on the line this afternoon are accessing or have available in your state, that your state have given priority to including respite resources. Medicaid waivers, every state is unique. We have respite available through our aged and disabled Medicaid waiver. We also have specific respite requirements within our developmental disability waivers. And within the developmental disability systems, there are multiple waivers, but certainly respite is available to them. The block grant has respite, although not utilized to anywhere close to the extent where it needs to be. Title III Older Americans Act, we work closely with our Administration on Aging, Maternal and Child Health, another partner, active partner in taking advantage of respite resources. We have foster care, child protective services, and within the foster care and CPS systems, we've identified significant growing need, and in our state we're under tremendous work to improve our system, and folks are within the system, both within the Health and Human Services arena as well as our state partner, or state and private partners are working diligently to improve system. But a great number of calls from both foster families as well as children at risk of moving into the system are there. Adult Protective Services access and have funds available through the Social Services block grant for adults. And then we also have in the state, in Nebraska, our subsidized adoption agreement does include respite, and if a family does have a child or children with significant needs, they have the ability to have an increase in the amount of respite dollars available to them, because on almost a daily, if at a minimum a weekly basis, I receive through the Respite Subsidy program referrals or requests for respite services through sub-adopt agreement, so I'm regularly referring them to their local worker or to the state manager. And then, of course, through our Medicaid paid systems, as you can see, the variety of programs that have federal funding available as well. And through all that, we have the ongoing goal to be able to improve our data collection for the respite utilization for all these programs, because at the current time, while we're actively partnering with them for both being a receiver of referrals and sending folks based on eligibility criteria back and forth, we have a goal to be able to capture the numbers so we have a better idea beyond the Lifespan Respite Network and the Lifespan Respite Subsidy program, what kind of numbers that we're impacting, because now we're only able to track referrals out. And I do certainly want to mention, when we're talking about the funding issue, that because I mentioned, and if any of you were listening carefully, you might have caught, and the question being, well, what happens to the eLifespan Respite service or system once the AOA grant is ended? Well, the fact is, the ongoing commitment by using state dollars has been made, so there is not a risk of losing what has been found to be extremely beneficial for our efforts. So sustainability is always a key need. And then continuing, I wanted to mention Nebraska does contract, or we refer to as subgrants, with 6 organizations in the state representing multiple counties, including the University of Nebraska, to provide respite network services. And these contracted entities do not have an administrative role with the Lifespan Respite program because it does have separate funding, but certainly that is yet another goal, to be able to better merge the efforts and being able to identify what the impact of our work beyond other means, but in terms of specific families that are able to benefit directly from the respite subsidy program when, in fact, they are eligible for that. And as I had indicated a couple of moments ago, the Respite Coalition is separate, and yet it is a part of our network activities. Okay, just to give you an idea, again, within the 6 regions, where people are at, and then in the next slide, without going through all the detail for the sake of time, I wanted to give you some insight as to a sprinkling of the activities or responsibilities of our respite network. So within the next couple of slides, you'll see that some of those issues. Now, for just a moment, I wanted to focus on the Lifespan Respite Subsidy because that's the one of the 2 key pieces of funding available to us in Nebraska. But for the subsidy, folks do need to meet financial criteria, and I wanted to have you understand that this is a program that is much higher than many of our programs available within the state for public funds, because it is at 312% of the federal poverty level, which allows a lot of folks who might not otherwise, if it were a strictly low-income, needs-based eligibility program. And the caregiver must reside with the client or with the care recipient and cannot be paid. And we sometimes find it a real challenge because someone may be receiving money for another program to assist their care recipient, but if the care recipient or the caregiver is receiving money, we're not able to have them take advantage of the respite subsidy program. So that's, I think, just enough. I wanted to give you a basic idea. It is a lifespan, which means we do have an active caseload that spans throughout the lifespan, and into that fiscal year, state fiscal year, which of course is July 1 to June 30 of each year, we did serve specifically through the Respite Subsidy program 744 persons, and out of that number, 165 were children. And as you can probably imagine, this particular program does have a substantial turnover rate because oftentimes people are not either willing to use respite resources until late in the need of caregiving, or we do have people that then go into institutional care, specifically the nursing home in most cases, or perhaps the number of deaths that we encounter. So we have the 744 number could be even much higher than that. So, and another aspect of the network coordinator responsibility is to assist with provider recruitment, not only for our program but for other Medicaid programs, some of which I had listed earlier within the federal funding streams, to give you an idea. And that's one area that in my involvement I have made every attempt to have our network coordinators become acquainted with the family providers, specifically through the Respite Subsidy, because the respite coordinator, for anyone that we use and that we send out to our partners or to families, the coordinator completes the following registries. We have within our department an Adult Protective Services registry as well as a Child Abuse and Neglect registry, two distinct registries. We access and identify any concerns through the Nebraska Sex Offender website, as well as obtain a criminal history on the person. And while the Respite Subsidy participants or caregivers are encouraged to use a provider through the network, or at least participate in terms of having the provider checked, by no means does everyone do that, because many times respite subsidy families might be using a family member and they don't see the need for that. And so that's another area that we're working to improve the collaboration between the two entities, between the network and the respite subsidy program. And fortunately, in my capacity, I'm able to identify those issues when they arise and then develop plans in order to address the concerns. We do list what we refer to as public providers on our Nebraska Resource and Referral System, and we're coordinating with our Aging and Disability Resource Center website, which continues to be in development. It's not yet live. And I wanted to point out that a public provider is one who has agreed that their name might be posted in the public place so that others might be able to call on them for respite resources. Many family members, for instance, or a friend who is providing respite specific to an individual family may not be interested in having their name posted in a public way. So we make reference to a public or a private provider. Okay, so with that, I want to turn it over to Charlie, who will now introduce us and actually demonstrate how what I have taken, how we are using our technology to improve what we have. But before she starts, I don't want to neglect asking if anyone has questions, and we will unmute if anyone has a question to ask.
All callers are unmuted.
Any questions that, with the information provided so far? And again, you can always include it in the chat box. I know sometimes on my own participation on national calls, I may not always be as comfortable speaking up, but you can certainly type your question in, and we'll see that and incorporate it into our presentation. So we'll go ahead and mute again, and then Charlie will continue with the presentation.
Thank you, Sharon. The eLifespan Respite system is really based on a couple of things. One is to be able to view, let me back up a little bit. Looking at the respite regions, sometimes you know that providers might live in the other region, but might, cross over, you might say, and provide care for the caregiver in another region. That was a big challenge in the old system, and so that's where we kind of started. There were several meetings with the coordinators as to what was working with the old system, what wasn't, what would they like to see. And so over several months, a wish list was developed, and then we started programming. The eLifespan Respite System is really online information and referral system. It's real time, so that if I'm on the phone with a caregiver or a caseworker, I can put in their information and provide some providers that will come up. The system itself is really based on needs of the care recipient and the caregiver. Looking at a whole host of different areas around, ADLs. Are there any behavioral emotional needs, any medical needs, location of service, time of service needed? Are there any funding types that they are tied to? So that looking at those needs then will match with the skills of the provider. And so how we did that is we asked the same set of questions that we do with the care recipient to the provider, so then we can come up with a definite match. And so it provides needs with skills of the provider. I'm just whipping right through here. It comes back in a list, and as you'll notice, you get a whole list here. If they were previously referred to the caregiver, it does show that and on what date, but it also shows by distance as well, so that it's based on needs, and then looking at the distance from the provider to the care recipient. It also identifies those that will also transport. You get the list. You can email the list. You can talk to them over the phone, or you can print out a list and hand it to them. There's several different ways, that you can provide a list to the caregiver or caseworker that is working with a caregiver. After a provider then is referred to a caregiver, we ask a set of questions about 30 days later to see if they used the provider. If they did not, we ask them why not. And you can see here if they said no, they didn't meet the needs, not ready to use respite, used another provider. So it gives us some sense of, why a provider was not used. But if they did use it, then we ask quality questions around, did they show up on time? Does what they are supposed to? Did they respect you? Did they have the skills needed? Follows your instructions? And would you recommend? These set of questions match other programs that then we can get a sense of overall services in Nebraska, respite being one of them. To help with the 30-day follow-up, we have a host of reports that are generated to then be able to follow up with caregivers so that we know, we need to contact them to follow up with them. Other reports that we help generate, Sharon spoke about the different background checks that we do in Nebraska, and it allows to say, are they accurate, are they current? You can upload the actual release form, you can take notes, and I should say that if a provider does not have updated background checks, they will not come back in a search. So just so you know that. Other reports that we have, of course, is around the provider, so that you can see across the state at a glance what type of skills that the providers have, the length of time that they have been a provider, and then you can match that then with the caregiver report to then say, okay, I have these needs for caregivers and care recipients, but it looks like we're short in this particular area. So you can do like a matching to make sure that you can identify gaps and barriers and then have a plan to address those. This is just a screenshot of what the background check looks like. Of course, red is out of date, that sort of thing. The contact report, this identifies, the number of contacts, number of unique contacts, and then to highlight the utilization of respite funding, we ask the caregiver, have they applied for this possible funding source? If they haven't, are they receiving it? They're not eligible or they're not interested. And this will help identify us in targeting certain programs so that we can identify, the needed areas by caregivers. One thing that we'll be adding is, did the coordinator refer them to any of these? So that helps, utilize respite funding sources in a way that we weren't able to do before. Provider report, pretty general stuff. We have more stuff, but we also keep track of how many were deactivated and the reason why. Did they request to be removed? Was it for health reasons? Was it, that they did not get any referrals? So that we can then try to provide strategic planning around provider recruitments. And then one thing that was added was the ability to put in your fiscal year budget, and then Sharon at the state can then pay off of the invoice each month from the budget. So how that works is that I put in my expenses for the month, and then I close each category, and once it's closed, then the coordinators can no longer open that. But if there's a mistake or something, there is that ability by the state to reopen that certain category. But then Sharon can take that as their final submitted report and then make payment to the particular region's agency. Activity logs, we do, there is an expectation that there will be some outreach, there will be training, as discussed a little bit earlier, and this is a way that coordinators can really put down what exactly they're doing, and then when they are ready to do strategic planning, they can see at a glance. You know, you can do a search for, like, I want to see all of the training that was done in January through April. They'll be able to search for that and generate, and then take a look at the gaps and barriers and what was the outcome and how many people were impacted by that. So it's really a way to be able to not only gather the information, but then really use it in your strategic planning for the following year. One thing that Sharon had mentioned is that, you know, this is, since we are a huge state, we being Answers for Families have built a little collab. Well, we call it a Answers for Families collab. But it's really a space, if any of you have used some project management type things, you can you know, create your group, and then in that group you can review any documents. This happens to be rules. You can view all of them. You can have discussions. You can have upload documents. And then you can also upload events that are coming, so that the whole agencies that provide respite coordination are able to really collaborate. What we're adding to this particular thing is to have an online chat, so that if there's any questions, they can just, instead of shooting an email, they can just type in, you know, what about this kind of thing, and have it taken care of right then. And that will kind of open it back up. I do see that there is a question, so let me go ahead and unmute everybody.
All callers are unmuted.
Jane, this is Sharon. Thank you for your question. And to respond to that, dedicated employees, I work and I'm an employee of the state of Nebraska Department of Health and Human Services. And with the respite subsidy, we have some shared responsibilities by another staff person, but no, there's not, through the program in a formal sense, it's me. And I not only am currently involved, and we're down a couple of staff, so hopefully at some point we will be able to get back up full staffed, but I am doing case management work, as well as I manage the network and manage the contracts. And as Charlie was demonstrating, with this being a secure system, it means just that. It's only open to authorized persons, and that is one key means that I'm able to manage the workload, because I'm able to, before I can pay an invoice on a monthly basis, I need to be able to see the reporting that's been done by the activities and other means, because we've incorporated into this eLifespan system all the areas that are required within a statement of work of the contract itself. In addition, we have incorporated in one way or the other adopted standards that are not only an attachment to the contract for the 6 regional respite coordinators and their agency staff, but it takes in all of the legal commitments by one means or another. So those individuals that are working under a contractual relationship out in the area, some of the 6 regional sub-grantees will have respite assistants in their offices, but otherwise it's going to be on a volunteer basis through every one of the 6 regions are required to have an advisory board, and we all know that an advisory board is a voluntary commitment that is being made, and then with other partners. So it's predominantly either contract and as Answers for Families, working under contract, or voluntary.
Thank you.
Of course. Other questions, please?
Sharon, this is Jill. As a follow-up to that, in your 6 regions that are part of the Respite Network through these subcontracts, there is a respite coordinator, though, who is paid.
Oh, yes, that's right, absolutely. That's the element within their budget that they may have an assistant, not all do, because of the volume and what their agency had proposed, that they're capable of being able to meet the statement of work obligations of the contract. But yes, they are paid persons, but not, and they're not an employee of the state, nor are providers employees. A provider is considered an employee of the caregiver, in a sense. It's a different relationship, but we're very, very careful that providers are never perceived as being under any obligation to the state of Nebraska, or specifically Health and Human Services.
Could you very briefly give us just some of the basic funding sources for supporting funding for those coordinators? That
comes out of our tobacco dollars, what we refer to as state dollars, and we'll go back to the specific, here we go. We have state funds with tobacco settlement dollars, and then some of the monies that were available through the AOA, or Administration on Aging grant, have funded the network coordinating subgrants, as well as a small Department of Education grant.
I know at one time you were using Medicaid administrative dollars for supporting your infrastructure. Are you still doing that?
Not so much. I mean, that's where it gets complicated, and I was trying to keep this fairly straightforward this afternoon. There are, within the tobacco settlement funds, there's different categories. One are admin dollars, and then there are service dollars, and monies are taken from each, but it's been made clear in recently how we're paying for respite services. It's not Medicaid admin dollars at this time, because these are not Medicaid funds that we're using.
Right, okay, thank you for that.
Adrian and Katie, recruit that is. Can you provide just a bit more detail for your comment or question, please?
The question was, do you proactively recruit? I just was correct.
Oh, okay, I read the last one and not the one before it. My apologies.
You mentioned something about tracking why somebody would deactivate themselves from the provider network, and then you alluded to recruiting. Right. So we just wondered what your recruiting process was.
Absolutely. And if I'd have read your question in order, it would not have been a challenge. Gee, how that works. Oh, you read from right to left? Oh, I thought it was left to right. I guess it is left to right. Therefore, I have issues. The recruiting process, in our logo, we include a 188 respite number. That is a toll-free number that providers are able to call into, caregivers call into, referral sources call into. That is one means that we might be able to identify a party who is interested in delivering respite services. Certainly that is by no means the only, it's just one of many ways. Some of the specific responsibilities of our respite network coordinators and their agency staff include the recruitment. That happens through public speaking engagements. That may happen, and I do this on a regular basis, when I'm answering questions, for example, for a caregiver who is providing care for someone through the Respite Subsidy program, and they have questions about whatever. And I might ask them if they're interested in providing care for other families. And if so, then I will refer them to the appropriate regional coordinator to pursue getting more information. That's one way. Other ways, folks go to health fairs. Again, a lot of public speaking. NRRS, or the Nebraska Resource and Referral System, which is a component of Answers for Families. It's a website that provides an extensive listing of categorized resources. That is one way to learn more about respite. The recruitment and training of respite providers can be a webinar in and of itself. It depends on the creativity and the resources and sharing best practices, which this system has tremendously improved the ability for coordinators to understand what one another are doing and to literally mentor one another, both by viewing one another's reports. We have an upload feature where someone may have their news media outlet or their news release shared online, and so that can be used in another region. They may share one another's brochures. We have worked very hard to provide an improved consistency from one region to another while still allowing for uniqueness based on needs of a particular part of the state. We never want to lose that, but at the same time, we know we live in a mobile society where people are moving from one region to the other, and we don't want people to be able to have access in one area to resources and then drive 10 miles to a border county and not have that available. So many of our forms are now a consistent network-approved form versus each region having their own. So that assists with the provider recruitment. But using the resources of an advisory committee to help with recruiting providers, certainly there will always be the need to recruit what I'll call generic providers, even though you saw that we have many ways when a call is being received or through an email. I mean, any number of means of providers being able to reach us. But when the matching happens, then we get down to a greater degree of detail. But we do have some that have a wide ability to work with both an elderly person one afternoon, and perhaps they're working with a 10-year-old with severe autism with limited communication skills, to an adult who has a chronic disease and has limited physical mobility. Many of the providers, however, do have a specific population that they may be more comfortable with based on personal or professional experience, as well as what training they may have received, because the training of providers is also a network coordinator responsibility. Not always to deliver the training itself, but certainly to identify what training is available and to make that information available to the providers so that they can take advantage of it beyond a basic training that includes an orientation to the process and the different respite services that are available through the various funding sources. Does that give you a bit more insight to the provider recruitment, Adrian and Katie?
Yes, absolutely. Thank you.
Of course. Other questions, please? Then I will ask those of you on the phone, do any of you have a system that collects the kind of information that Nebraska has captured through our eLifespan online system?
Hello, this is Joyce in Texas.
Hi, Joyce.
Hi, and we don't collect as much information as you do, but we do collect information on the type of respite that providers are willing to provide. emergency or crisis respite, medical, non-medical, that sort of information.
Okay. And you mentioned the crisis respite, and I spoke just very quickly about it, but that has been somewhat new, and there had been planning for a great deal of time, but limited decision-making until a few months ago, and then in January of 2013, we did, with a variety of input, extensive input actually, over a number of years and a variety of means, drafted guidelines and provided statewide pilot in using funds, and as I say, that proved to have some successes, as well as some areas that need additional attention, but the need then to recruit providers willing to serve as a crisis provider, and making sure that first responders, and a first responder definition can mean many, many, many different things, and identifying who those providers might be, and then going out and having those one-on-one conversations, working with the trade associations, the large listservs that are available, for instance, with firefighters across the state, or the emergency medical technician networks themselves, and making them aware of the respite resources that are available to the child care providers who may have already been providing what I'm referring to as traditional respite, but seeing if they're willing to be a crisis provider based on Nebraska's definition of a crisis. And that certainly is somewhat unique to Nebraska, looking at national best practices, as well as what has been identified as needs within our own state from previous referrals. So if additional questions do come up after you mill over the content that we shared today, we have our contact information available on the screen, and well, as Charlie indicated, this will be posted, and Jill, I'm assuming it'll be posted on the ARCH website, as well as our own Answers for Families and other places. But if you have questions or would like more information, we're more than happy to respond offline as well.
This is Jill again. Can I ask one more question of those who are listening?
Absolutely.
We have a bit, and I know we're getting close to reaching our hour time limit. I think it would be helpful to get a sense from people, if any of you, I know, with the limited funds that you have, those of you who are developing respite registries, or collaborating with your state INR system or your respite coalition, are primarily collecting information on providers and then putting it online for families or their case managers to access. This system, I think, is a little bit different, and correct me if I'm wrong, Sharon, in that it's not readily available directly to family caregivers. This is for the respite coordinators to use, so that they actually have to engage in a conversation with someone who's calling?
That's correct. This site that we've shown is secure only to authorized persons within our system that have grants with us.
Is there any other state that's doing anything similar to that, whether you're doing it perhaps with your ADRC and using ADRC counselors who have been trained in options counseling, where you're really interacting with the person seeking the information to provide more one-on-one kinds of direction? Is anyone else out there looking at that kind of system? It's very labor-intensive, so I'm imagining that not too many of you are. Is my question, it's probably not clear either. Well, I just wanted to get a sense of if there was something similar, to the way that you have your network system set up, Sharon, in Nebraska with your 6 regional respite coordinators.
And we do want to make sure people understand that the provider information is available to the public through the NRRS system, or the Nebraska Resource and Referral System, that is a public element of information, but the vast majority of content that we shared today is private or secure. And again, we are working closely with the Aging and Disability Resource Center team, and I've been actively involved in the last few months with that as well, so that some of which that we have already developed can be incorporated into the ADRC site once it does go public. So there will be multiple ways for families to be able to access this information.
Yeah, excellent. That's great.
This is Joyce in Texas again, and actually, Jill, you brought up a question or an issue that we would face if we were trying to do this, which is potential liability from having a listing of people that you're effectively sanctioning or recommending, and I'm wondering how you deal with that.
When you say recommending, it's just making available a list that of individuals or organizations who have met base requirements. It's not necessarily recommending. It identifies what the provider has indicated that they have expertise or interest in providing.
So do you have like a disclosure statement that you provide where you say we're not recommending these, and state is not telling you that these are the best providers or something like that?
When the providers are exported to the NRRS, there is a disclaimer on the system saying that it's no certain one is recommended, so there is a disclosure on that. However, there is not really a disclosure on the list that is generated by the respite coordinators. However, there are training components that how do you hire a provider, and so that is a area respite region's responsibility to provide training on how to hire a provider.
And within the various programs that have respite resources available to them, each of those programs have a variety of criteria for the use of providers, depending on the funding source. For example, with the Respite Subsidy program, it's within our regulations, and it's on the application, and it's on the letter of eligibility that the family has the privilege, really, of identifying who their respite provider will be, that we're not assigning anyone. But so that, I believe, in a multitude of ways is how we're addressing any potential legal liability. Those are very important points.
Thank you for that. Jill, again, also, aren't all your providers, they're vetted through your background screenings?
Absolutely, because if they're not, or if there are any concern, they don't make it to the public sharing of being a qualified provider.
Or they won't return in a search internally as well.
And we work closely with Health and Human Services. We have what we refer to the position as resource developers. And for most of the federally funded programs, that provider has a very lengthy provider agreement. It's a legal document that they must sign, and again, specific to the programs, but we work with them on individuals that perhaps are providing services both for some of the respite programs as well as others that are available through the department. And if the person does not meet many of the same expectations, they won't be used by any means. And there are legal explanations on the provider agreement. But the subsidy is unique in that we do not have any specific role in determining who provides services. We offer assistance, but we don't assign a provider.
Jill, it looks like we've met the 3 o'clock hour. Thank you so much, Sharon and Charlie, for what I think has been an excellent presentation on the eLifespan Respite System, but also just better understanding how the Nebraska Respite System works. And for sharing all of this information with us, we're very grateful to you. And as Sharon said, this information will be made available through them and also through the ARCH website, and we'll send around those links as soon as they're available, as well as copies of today's PowerPoint slides. We'll make those available also. With that, I want to thank everyone for joining us today, and thank Sharon and Charlie again, and be sure to join us for the next Lifespan Respite Grantee call on July the 16th.
Thank you, Jill, for the invitation.